Welcome to the Community Health Enhancements. The Community Health Enhancements are designed to enhance Athena practice accessibility. We will begin in the schedule just like the patient scheduling journey would begin. Instead of right-clicking on the appointment, we now can click on the appointment and then click on Appointment Details. The Appointment Details has all information related to the appointment. This includes appointment status. So we can change the status. We can see here it's left message and at home. Eligibility, balances and credits, sliding fee history, all active insurances that may apply to this ticket. We're also able to see all historical information in the appointment details. Normally, you would click on View Appointment Activity List or open the appointment to view any messages of the provider information, etc. With the appointment details, it's all in one place, including patient information, address, and telephone. There are new additions to the appointment details you are not able to see in the schedule without jumping to registration. One is the patient balance. We now have patient balance showing here. Another is the status of eligibility. So if the patient has eligible insurance, it will show the effective date. And if billing profiles are used, all active carriers in the billing profile have eligibility checked and will appear here as well. So if you have more than one carrier that applies to this particular visit, you would be able to see each one of those. So you can have a secondary and a tertiary. We will discuss the billing profiles more in depth in a little bit, as well as programs. These are two new additions that have come to the Community Health Enhancements. From the appointment details, you can check the patient in, update the status, and access all aspects of CHE. Clicking on the patient, which is way up here, will show the CHE ribbon, allowing navigation to the CHE modules. Clicking on the patient will show the CHE ribbon, allowing navigation to the CHE modules. Clicking on Patient Survey takes you to the Community Health Demographics. Patient Survey displays language, agricultural status, citizenship, as in the Legacy CHC. It also includes the SOGI information, gender identification, pronoun preference, and sexual orientation. The Income Survey has been updated to include multiple streams of income on an annual basis, a weekly basis, bi-weekly, monthly, and bi-monthly. If I were to update the income, I can click on Update and it will show me these different sources that are available. This would also update but not add a new historical record. So if I were to update the patient and they are now bi-weekly to $2,000, they don't have anything in child support or disability income, it will show me my annualized amount that they make. So they make $48,000 a year. And based off the number of family members, it will give me their level of poverty as well as an effective date. So you can see the effective date is here and we go to a year. One of the improvements that we have made is we've added a 3-digit beyond the decimal point to give more accurate poverty levels. Once I'm done with the update, I can click on Save. And then it will give me any errors that I might have of things that I might need to update for this patient. And we'll get to the housing survey in just a moment. Next is patient insurance. And if you look to the left, you would be able to click on patient insurance and it will take you straight to it. Here it will show us all the patient insurance that are active for the patient. And we would be able to verify any of those eligibility through the patient survey. Next, we have the housing, and it requested an update. As you can see, our next review date was 12/25/2020. So now we can update the housing survey based on that 6 months that is set within the administration. So I can continue. I can say, no, the patient is not homeless. No, they do not have public housing. And if I needed to, I would be able to add notes. Once I have completed my update, I can see that July 5th will be the next time that they will be required to update the housing survey. I can click Save, or I can click Save and Close. And once this closes, it's going to ask me in this particular case if I need to update other guarantors, and I can update the guarantor and click on Save. This will affect both the guarantor and the current patient you're working on, and it will bring me back to the schedule. And I can see my next patient. Eligibility is also part of patient survey, and that is something that is new to the community health enhancements. So I will go ahead and show you what that eligibility looks like very quickly here. I'm just clicking on patient survey from the ribbon. And since I'm going to go to patient insurance, I'll go ahead and click on that on the left. As you can see, we have multiple carriers that are associated with this patient. You can see verify or view are available. In this particular scenario, I'm going to go ahead and click on view, and I can see all of the verified status. By opening the status, I'm able to go through and look at all of the information that is regarding the insurance for this particular patient. If I go ahead and maximize this, I can click on search. And if I was looking for a specific thing, let's say I want to see copayment, and I can look at my copayment. Here's my copayment, and it will show me what my visits are. So my professional office visit, which is a 98, that's a type of service, versus a 96, which would be a specialty. I also have messages that tell me whether or not it's a specialist. And you're able to search this data as you go through. Once I'm completed with what I'm looking at, I can go ahead and save and close. And it tells me that, again, I have housing survey. So I can go ahead and click on my housing survey. And I can update because it's asking me to update. And I can again say no. I can see stable housing and employment. And if I wanted to put a date here, January 5th, 2021, patient is in stable housing and employment. And go ahead and save and close. And update any patients. Now that I've updated information, it has opened up patient registration, but I can go ahead and go through and close unless I have some insurance information they need to update. And I'm back at the schedule. Now let's go ahead and review billing profiles. Billing profiles can be accessed through the main menu and the Visualizations menu down to Community Health. So billing profiles, when implemented, automates case assignment by specialty or appointment. Billing profiles are designed to handle multiple primary carriers such as dental, medical, or behavioral health primary carriers. Billing profiles also work with our eligibility automation and will check eligibility on all active carriers. Eligibility can even be verified and viewed from within the billing profiles. So let's go ahead and look at those billing profiles. If I click on Home, I'm able to go to our main menu. So here we have our billing profiles. We have our perinatal cases, which we'll speak about in a minute. Before that, we'll go ahead and go to program tracking. So billing profiles allow us to review patient information. So I can go ahead and search for my patient. And I can look at each of their existing profiles. So I can look at medical and see what that looks like. I can see that there's no valid eligibility status as of November 17th. I can also click on that information and it will take me to any EDI response that may be available. I can also view eligibility, and it can tell me whether or not there was a failure, and tell me the sliding fee carrier, and then it can give me any history, and it'll say when it last was verified, and it can show that it failed. This is sliding fee, so that doesn't surprise me. However, if you do have a carrier assigned to a sliding fee scale, you would be able to verify that insurance if you have all the appropriate information. The billing profile will allow me to have multiple tabs to it where I end and begin new insurances, and the dates of service will be applied to those. I can click on back to summary, and it will give me the summary of all of the carrier existing billing profiles and any that might be of use. Next, let's talk about our programs, and we'll go ahead and go back into Home, and let's go to the program tracking. Program tracking is the ability to add funding sources to a visit and then track them through Viz reporting financial reports. Program tracking setup allows for ledger information, effective and expiration dates. This functionality is designed to be attached at the patient visit. A carrier can be created and set up via the approval plugin to require a program. You have several options in the way that this works. So let's go ahead and look at the test patient. And if I had a program, I can see if there's anything there, and it says there's nothing there. I can see future appointments, please note, on the left-hand side, as well as the sliding fee guide for this particular patient. I also have my ribbon, which is communal on every single screen when I go into a patient. So I can add a program, and I can search to see if there's anything out there. And here are all the programs that I have available. Please note that I use the asterisk to do my search. So if I needed to, I would be able to do grant services for adult services. I would be able to add that to the patient. I can put a begin date and end date and do any entry notes and then add the program. This effectively would add the program to the patient. I would be able to track all of those visits that would be associated with this particular funding source. Last but not least, we have our perinatal cases. Perinatal cases actually has its own button that you can click on and have your clinical staff enter information in regards to their OB patients. If I look for a patient, and I find one here that has OB Medicaid, and I can go ahead and open the case. So the perinatal case has changed in its view. The case interface allows for menu options to be clicked on the left-hand side, and case templates can be added to each of your perinatal cases to simplify billing. In the case, we have case button. We actually have a case that might be assigned, as well as any of the providers that might be seeing this particular patient. We also have insurance to show which insurance and who is authorized to see the patient. If you have authorizations, then you would be able to add those or edit any authorizations that might be available. Under perinatal, it shows your standard information that we've had on the perinatal case for a very long time, which means that you have transfer in and out of care, case manager, first visit, trimester care began, and then you would be able to add the infant if needed. So if you add an infant, you have your status, ethnicity, race, last and first name, birth weight in grams or pounds, outcome, 2 weeks for mom, 2 weeks for baby, and then 6 weeks for mom, whether or not it was a high-risk transfer, high-risk category, and any APGAR scores. You can also add any other information that might be pertinent to this particular infant. For mom, you have the OB history under risk factors, any fetal anomalies, other findings. You also have whether or not they're going to breastfeed and other information that you might need to add to that. Whether they're a medical high-risk category, if there's any psychological or social high-risk categories the patient might belong to. You can also add a risk factor and choose the date and information that this risk factor applies to. And there's a list of risk factors here. Also for mom, there is a weight grid so that you can actually track weight for the pregnant mom. There is also a weight grid. You can track weight gain and or loss and height in inches to make sure that the patient is gaining weight as they should be, or whether or not they are underweight or maybe they're a little overweight. Once you've completed this, you'd be able to save the entire case. If you're not updating anything, you can just click back to cases, or you can close the screen. Thank you for viewing Community Health Enhancements, and hopefully this will have shown you what we have completed for V20 and moving and upgrading to the Community Health Enhancements.